Would you do your current job if you had $1 million? What if you had to work 16 hours a day? To top it off, what if people died on your watch and you had to make those calls? I guess that too. I would not do that. But our guest today is exactly that and excels at it. Today we're going to talk to Dr. Mithun Jakkan. He's one of the best spine surgeons that India has produced. He was born into wealth and had never need to work, but still he chose this field because of his passion and this divine sense of duty towards the society. Today we're going to find out how he balances between his passion for serving people and his family and hobbies. I hope you enjoy our conversation. Hi Mithun.
Hi.
Welcome to the podcast. Thanks for taking time out of your busy schedule to join us.
Thank you.
So let me ask you a very interesting and burning question that has plagued humanity for many, many years. Why do doctors have such a terrible handwriting?
See, the thing is, majority of the time we'll be reading and writing so much in our whole career.
Mm-hmm.
Our MBBS career is of 6 years, followed by 1 year of struggle, then get a postgraduate, work for 3 years. Your priority is always to see high volumes of patients and treat them, and your things in the back of your mind will be something other. So you never bother to look good or write good. So what your patience gets over. When you write something and just finish it off.
Okay.
And most of the doctors have typical prescriptions and typical thing which can be easily anticipated unless and until some rare prescriptions or rare medicines or rare diagnosis. So it's like understand us like okay, and we lose our patience in writing in detail.
Okay.
But now what government has done in our country is they have made to write in caps mandatory.
Okay.
So from since 2014-15. So at least because of that, a layman or a common man can read and recollect it.
Oh yes.
So we try and tend to write the prescriptions in capital letters, or most of them we give in printed nowadays. Everything because of soft copy and a lot of apps and this all they just we talk and they interpret and write. So the problem is solved, but still doctors have a terrible handwriting that I accept.
I thought it was a prerequisite to become a doctor.
People think it's not that way, but yeah, definitely we have to accept that.
Sure. So let's talk about doctor's career.
Yeah.
What is the typical journey of a doctor's career?
There are two ways to go, but the duration is the same. It's like how and where you want to practice.
Okay.
In allopathy practice, it's like after your intermediate or after your 12th standard, you have to write a separate entrance exam for it, a common entrance test in India, where you're going to go into government like a merit scale or in a qualifying exam where you want to go into a private medical college. Journeys of 5.5 years of MBBS, which is divided into first MBBS curriculum 1 year, second for 1.5 and third year, final year for 2 years.
Okay.
After that, is like 1 year of internship. Like, okay, you have to work for every month in other specialties. Every specialty is just to know, like, okay, which suits you are. It means it's a mandatory course. You have to get trained to take a basic knowledge in other departments. All departments like gynecology, medicine, surgery, pediatrics, orthopedics, and so on. It's a mandatory thing. You have to cover for a scheduled time. It takes around 1 year. After that, you have to prepare. Again, the same thing starts. Again, an entrance.
Okay.
Then you think whether you want to become a general practitioner, the MBBS is enough. No, I want to become a specialist like what I am. Like I'm an orthopedic surgeon. For that, I have to again give another entrance exam where almost more than 1 lakh doctors will be sitting for a limited number of seats, for around 7,000 to 8,000 seats, to get in a merit seat, like in a free seat.
Okay.
Otherwise, if you take the same thing in a private college, just you need a healthy bag, wealthy bag, you can say. We were not going into the cost of it, but it costs a lot of money where everyone cannot afford. But in this, again, you have to spend 2 years for a diploma course and 3 years for a master's course. Where it's typical like any master's, work in that specific department for 3 years, see patients under guidance, assists cases or do cases or procedures independently. Then after that, you are a certified specialist. The journey don't stop there. again what happens is whether you want to practice as a broad specialist, like a general medicine physician or a general surgeon, or you want to become a super specialist, like there are subspecialties. If in orthopedics, there is a spine surgeon, there is a joint replacement surgeon, or there's a pediatric orthopedic surgeon. We have this now. The diseases are being dealt so deeply, and so the accuracy is so much. So everyone is trying to develop themselves into a subspecialty.
Okay.
For that, again, you have to spend another 2 to 3 years, depending upon which field you are going. For if you take my case, after finishing my orthopedics, I again prepared for 3 months to get into a merit seat. We almost 1200 orthopedicians wrote this exam, entrance exam on orthopedics, and top 10 candidates. I was lucky that I got 7th rank, all India 7th rank. Top 10 students get the seats, which are spread all over India on merit basis, where you will be paid stipends and you have to work in the department day and night without any time limits. Means how much you want to learn. I did for another 2 years in that. So then after that, we have to write an exit exam where you have to pass with the proper theory and practicals, and see patients, treat how you treat, how are your skills, and so on. So it's like a journey of, if you want to do a general practice, 6 years of MBBS is enough. If you want to be a specialist, 9 to 10 years. If you want to be a super specialist, it goes to 12 to 14 years. So it's a long journey. It's like focus what you want to be, and patience.
First of all, I would like to commend on your enormous amount of patience to go through all this and be here.
Every time I write an exam, fight for the best.
So, in a country like ours, where there is this binary of engineering and medicine, and you tend to invest so much time, at some point you must be also be envious of people who are studying engineering for 4 years and starting to get good amount of money at the beginning, and you're still struggling. How do you deal with that?
See, here comes again the same thing. It's like how passionate about. If you are not passionate about medicine or a doctor, then you should not do it, because what human brain thinks is always the easy way out of living life, earning life, want a good quality of life, monetary wise, everything wise, social wise. You finish your degree early, you get good job, get wife, get house, get kids, everything early. We in medical field, it's like if you love your subject, or if you're passionate about treating patients, you get kick or happiness in that, then you should opt for it. Otherwise, there is always a distraction. My school friends, who we all got together they got into engineering, we got into medicine. I didn't even finish my MBBS. They were offered jobs at the end of their engineering third year with a good amount of packages, which just lucrative package. Once even if you hear, you start feeling guilty. Why I have chosen this profession? So that is very common, but that is momentary. But once you see one patient or diagnose one problem of a pain, if you diagnose what is the reason for pain of a person, and at least you treat or you find the cause, that's satisfaction. You should be passionate about it. Then only you can do. Otherwise, just for a tagline, you won't survive in medical field. That is the thing.
But how do you deal with, like you were talking about passion and treating patients, there's a downside to that as well, right? You see people dying.
Exactly.
How do you deal with that trauma? Does it give you trauma?
See, we are doctors, not gods. After going so many years like MBBS, postgraduate and so on, you know what at first instance you can come, especially if you take my subject, orthopedics and spine. If you see a patient, if you spend at least 10-15 minutes, maybe it's a trauma or some condition, a cancer of spine or a degenerative disease, you know whether it's treatable, we need some time and multiple surgeries, non-treatable. It's like where the spectrum, it's like a spectrum of treatment, where the patient lies. We are not gods. It's like you cannot treat or make everyone back to normal. We can change their life, we can make their life better. Even if you can't make some diseases, you cannot do anything, because the risk-benefit ratio, where risk is more than benefit, we cannot do anything. At least we would be able to explain the patient, but it's all about the person, we say. If you see a 10 patient, at least It's not mandated that you should make 10 to 10 patients fit and fine and happy. At least if you are changing 6 to 7 patients' life, that we think it's making difference in someone's life.
I'm pretty sure there must be stories where you thought you could save a patient, but it didn't turn out to be that way.
Yeah, so it's there are many things, especially when I remember, I'll tell you one story. A 10-year-old boy who had a brainstem compression. He was he had other challenges also. We did some 7-hour surgery. We at the brainstem we operated and we released everything. It was very adrenaline rush was going on because we were dealing at the most vital structure of the brain. At the end, when we saw intraoperatively, the result was we will make this child walk in future. But with other reasons, child could not survive.
Okay.
Because his lungs were not cooperating because he already was suffering from that thing a long back. So it was. So we were not we could give them the best. But the thing is that it's you put a seed in the soil and you put water, you put fertilizers and everything. But it's not that mandated that you get the tree of a plant or tree and you can eat that fruit. But okay, at least attempting is important. Many of the times happens we have done a very bad multiple fractures patient, they come with a road traffic accidents and this all. I'll tell you just 2 days before experience. A guy traveling in a car, his other colleagues died on the spot. He had neck fracture, he had thigh bone fracture, he had multiple lung, chest injuries, nose injury and this all. First one day we just told, we can't say for next 24 hours, even if it touch cheek may die. But after 24 hours, the patient started throwing response because maybe of his willpower, good body or good genetics. Then in one session, in 8 hours, we did his 3 surgeries. Even after that, patient survived and he is stable now.
Okay.
In the morning, we saw the patient is fine, talking, and we were it's we treat, he heals. It's you just do your job, but you cannot assure. And that tricky situation, if patients and their attendants are able to understand, then it's a good thing for us. Otherwise, we'll be always judged through their lenses.
True. There's another aspect to that. These days in India, you're never quite sure whether you'll be praised or being said bad words, because if the patient doesn't survive, then you bear the brunt of it. Have you had an experience like that?
A lot of experience. See, only not about survival. I'll tell you, patient wants, according to them, patients or the relatives, especially the relatives. It's first they come and they surrender. This is a problem. What should be done? So we see and tell, okay, this has to be operated or certain treatment. How much? First the comes, majority of Indians or in our scenario, they are not insured, a national insurance or a government. What they do is they keep doing window shop and they waste the time where the disease progresses.
Oh, okay.
And they come, no sir, you told last time that this would be done, so now do. But they expect the same result what should be at that point of time. Okay, we do it. Some residual things remain. Okay, I cannot give 100%, but at least I will be able to, I'm giving you 90% results. They start judging you, no sir.
You are not
well, but that 5-10% sir, it is there. Then they start judging the way the theatre you operated, where there is no place to sit. They'll keep judging you on non-medical issues.
Okay.
They'll keep judging you at the time of discharge. Okay, sir, how many days I need to be rested? Oh, so I cannot go for job. No, sir, I have a function to attend. The priority of the patient, it's I'm not blaming, but that is the mentality of the people. So that's why we don't expect that he should present. We only, if you don't give us a bad mouth of publicity is also enough. We take this as appreciation. And last come the finances. Then they come and ask for the bill. Everyone, no sir, this is too much. And they start bargaining. See, you can just imagine how bad it feels. If we are playing with your life and we are giving you a better life without compromising any medical technology. You want a best operation theatre, best surgeon, best equipments, best consumables, but you don't want to pay for it. But certain things, we need more blood. Sometimes we need more equipments where we need to open and do, because we on that table or on that moment, at that moment we have to get the patient out. So we don't think. Okay, excess of it's going out of budget. We don't think we just do, and we just say no, sir. You told us this much. Otherwise, you're a bad doctor. This guy is a commercial. He wants to lure money. And what mentality? All doctors are luteras. Means all doctors are like duckots. They want to loot money from common people by giving big name. I agree. 5% of our field are very professionals. They loot, or you can say they are bad people. It's in every profession. Just seeing that 5%, judging 95% people is not right.
True. You're talking about how people start bargaining about money. In a country where there is no proper healthcare or not everybody is insured, have you been in a situation where you have to see, okay, this person I can save him, but I know he will not be able to pay for the treatment? First thing is, have you been in this situation and what did you do and how did you decide?
In such situation, we've been many a times, especially when you are bound in a corporate setup or a corporate hospital. You feel that, but okay, we do first aid in any hospital, even a corporate or non-corporate. We give a first aid where any emergency procedure or emergency maneuver can save patient's life at that moment of time. We do that. Even the government norms are strict and humanity based. Any doctor or any hospital and that okay first aid. For example, a patient came with suddenly a vessel or a blood vessel cut and it's bleeding heavily. We just hope in the emergency casualties we just tie it or fix something where we can temporarily hold and save life. But the definitive procedure in corporate hospital, you have to send the patient. Patient is not willing. But in where for being this reason, I have cut myself from the corporate setups where someone cannot dictate me or someone cannot guide me or command me what has to be done and not. In a smaller setup, many a times where we have done without cost, without taking money, because patient if it's not affordable, we cannot go hold his collar and get money. But at least we have that satisfaction. Okay, he will pay or not, we don't know. Many a times patient have come back and paid. This situation we go many a times.
Okay.
Many of the time patient seeing our good intent, our aggression towards intent to treating him, they have come and paid. At least bear me sir, we can afford this much, but thank you for saving us. That gives a next level satisfaction. Even if we can't pay, okay, Almighty God, He's contributing in some other way, we hope in, and go forward. That happens. Sometimes you get a positive experience, sometimes a negative experience in monetary terms. But our priority more than money is to give the best thing which he needs or he deserves at that moment.
So you're talking about how you shifted from corporate to freelancing. For those who don't understand this, let me put some context to it. So you finished all your education, and then how did you end up in corporate?
See,
what is a corporate hospital?
Yeah, see, corporate hospitals are like, I don't want to take any hospital name particularly. It's like a hospital which is mainly, the show is run or the owner is run by some unknown person or a non-medical person like an MBA or a businessman or entrepreneur who just see it as a business module. Hospital is never a business module. First, we have to make it very clear. Then only we can treat and give a better life or a better situation to people. There they treat it as a business model. Okay, and in any corporates like offices, the employees are there. They have been set some targets that set some work to be done just by luring them for a job or increment or post or other luxuries. The same thing, not exactly, but these people hire doctors for some amount as a special, okay, some amount we are giving you this salary, you come join. Especially when doctors after finishing their 10-12 years of journey and when they see, okay, brand, okay, this is a brand and I have to go and join it as a consultant. They promise, okay, they're promising me doing good marketing, good advertisement of mine that I am a specialist available in this hospital. Okay, so and after such a starvation of such a long time, you always want to your life to be comfortable. So you go and join, fall prey to it for a salary. And what salary they usually pay are peanuts actually.
Okay.
They get this with 1 or 2 or 3 patients, and you work this thing for whole month.
Okay.
Yeah. And what happens is, okay, if you are getting good numbers, then okay. But still, if you feel okay, all specialties are not same. If you take a gynecology, the volume will be more. If you take a spine surgery, the volume will be relatively less compared to that thing. The generation of revenue. So they start pressuring you. Not all, but major. So start pressuring, convert more cases. Some cases which are in gray zone, whether to operate or not, just push them for operate. Let patient decide, or let you only decide and push the patient. And you just bend your ethics or something like that.
But what does that do to you as a doctor?
So it's like even we were the targets for it, but we chose our path. Like, okay, I spent 10 to 14 years to learn what to do and what not to do. To say when to operate this patient. He's just some MBA guy or some non-medical, I'm not respecting other fraternity, but coming and assisting or telling you, sir, just push, operate, let you do more surgeries so that things will be better for you and hospital and maybe for the patient. This dictating, I think I didn't like. So that is the reason. I'm not blaming corporate hospital. Everyone has their own liabilities and responsibilities. But I didn't felt like, okay, I'm fit for this system. So that's the reason I came out. Now I'm working more hours than what corporate hospitals are 9 to 5 job. Then after 5 you can just go home, play with your kids, have a drink and take your dinner and sleep. But here I work at least 14 to 16 hours a day.
Okay.
Hardly even Sundays also, if there are any cases or any emergencies, have to run, travel, go operate, see patients, talk to them and come. But that's okay. But at least here what I am doing, what I learned and what I love and what I'm passionate about.
Okay.
So that gives me good satisfaction, good sleep.
That's wonderful.
Yeah.
You were talking about freelancing where you're working for 16 hours. Can you run us through how that works? How do you make money out of it?
Yeah.
Not the exact numbers.
So obviously. So freelancer means not bound to any particular hospital or not bound to a particular salary or a particular working hours. If I'm an hospital owner, if I've employed you, your duties are fixed. Patients are coming or not, you have to come at morning 8, stay till 6, take this particular salary, or bound to me or not bound to any other hospital or not see a patient outside my hospital. Means these are the steps. A freelancer means it's like he can work, he can choose his hospitals, go meet that hospital. Okay, there are particular hours I can come or a particular time where patients will be coming. You call me and take my appointment. So certain hospitals where near my house or where in area my clinic is or where I practice, I cover some 7 to 8 hospitals where, okay, visiting consultant Dr. Mithun, a spine surgeon, will be available on call. Because if there any patient coming in emergency where needs a spine intervention or orthopedic intervention, or in certain orthopedic, some hospitals I go twice a week for 2 hours, scheduled time. So when patients get tuned, okay, this doctor will be available at this hospital. I go see patients, talk to them, whatever their conditions, see if any patient is getting converted to surgery, after that I operate. I go at my convenient time, take rounds. I coordinate with that hospital's in-house doctors to have a look. They'll be watching, I'll go and taking rounds and guiding them for the further treatment. With this, both are comfortable, me and hospital. Why? Because they are catering on specialty. They like a spine without I am being their liability. Means they don't need to pay me even if I'm working or not working. They don't need to pay me. I am asking only for which the patient I have seen. My OP charges, my operating charges, and my round charges, which I'm coming, seeing patient, talking to them. These are my operating charges I write, and I give the package according to patient's. The best thing is, the same surgery I do for a certain amount, same surgery I do for double the amount, same surgery I do for 50% amount.
Based on the
patient's requirement, patient's social status, and patient requirement.
Okay.
How this varies is like, suppose, an example. I am wearing a Reebok shoe and you are wearing a Bata shoe, like an Indian company, Bata. Both are good. Both have their almost similar life. Only thing, Bata comes at around 50 rupees or 100 rupees. Same Reebok shoe comes at 1000 rupees. So it's just for nominal sake.
Yeah, sure.
So but the quality of the thing is same. The operating surgeon is same. If I tell, okay, if you want in a bigger corporate hospital, the operative charges will be more because you have to spend for that hospital. No, sir, I want the same surgery in a smaller setup. So we can do it in a small setup.
Okay.
The quality of treatment is same, but other non-medical amenities like, oh, you have a nice big AC room in a general ward. You have a very good TV or a receptionist coming and talking to you. There is no receptionist. But you are intended for what treatment you will be getting without compromising the quality. This is the thing. So there's so much of freedom here. Means you can cater a very, like I treat even a security guard. In a private, he don't have an insurance, he don't have money. I operate the same techniques, the same technology, the same surgery, and to him and to his owner also.
Okay.
I have that liberty. I get 5,000 rupees, for example, I'm happy now, 5,000, okay. 1 hour surgery, anyhow I'll be taking lunch and taking a nap for 1 hour. I'm operating one way, 5,000, but I'm making his life better.
True.
So this freedom, you get in a freelance practice. You dictate, you set your terms, you decide which patient to treat, and no burden. One dark side of this is long working hours, and you won't get a lot of money which you expect. What would be this guy is working for 12-14 hours. He must be making money like anything. It's not like that. But coming to satisfaction and work ethics satisfaction level, I have double than others.
Okay.
And I have operated almost like since my fellowship and everything, we have operated, it means this last 2.5, 3 years since I've started freelance, I operated more than 1,000 spine surgeries. More than 1,000 with a logbook.
Okay. That's a lot.
Yeah. So that's the thing, because I'm able to reach more people. I'm able to do my work more happily. I'm able to do more risky cases. It's all like how we want. So that's how freelance helps.
Okay.
Yeah.
What goes on in your mind when you are operating? Do you go into a state of meditation where all your entire focus is there on the patient?
Yes.
Or is it?
It's like more than what we say, like all things come to just at one point. It's like when you're operating, especially in spine, where you will be dealing with such a delicate thing. One mistake, then patient is like paralyzed for lifelong. You'll be just playing some few mm's here and there to that delicate structure. When we are operating, we don't even realize that is there any bodily pain, or is someone is getting your pants off, or someone is calling you, or someone is around you who is standing you in another 1 meter. You don't even realize that. It's full of concentration, full of adrenaline rush. Even at the OT operation theatre temperatures are 16 degrees. We have to maintain that 16 to 18 degrees to prevent infection. Even under such conditions, once we finish the cases from inside, we'll be totally wet. Means so much of adrenaline rush. Because you will be like a war footage. Like, okay, concentrate or you will lose. There is a thing, there is a big enemy in front of you. You have to fight with full concentration. Otherwise, you are out.
But Mithun, we are all humans, right? We all have families, and there are a lot of ups and downs and stresses also. How do you keep it outside of OP?
I thank God that I have been gifted with that kind. Means till now, tremendous stress. Even what happens, you operate the best thing. Okay, this is the best thing I can give, or this is the best surgery I can do. But it's not always matches with the outcome. As I told, because when the patient comes with other cofactors, at the back of that stress, or we are human beings, some mistakes do occur from our side. How to rectify that? Okay. And some financial stresses, okay, I have to pay the bill and I have to get this through EMI. Sometimes we are down, sometimes we are up. So it's like sometimes OP or something. There's multiple stresses. Like major stress would be seeing patients, talking to them, convincing them, treating them. If you sometimes I operate maximum I have operated 5 to 6 surgeries a day.
Wow!
Because I started my day at 6 o'clock and I have removed my glow at night 12:31. Like this, there, so much of stress, like so much. Okay, you are enjoying that, but physical stress. So that is there. So when you take this stress, but good part is that God has gifted me. Is when I go home, when I park my car and get down and when I ring my home's bell, I forget everything.
Okay.
I make it an habit. Like, okay, whatever is it, you just take vitamin M and get in.
Okay.
Yes.
What is vitamin M?
Vitamin M is like manly happiness. Okay.
Okay.
Yes, I'm fresh, I'm fit, and I'm coming in.
Okay.
It's like what do you see in a mard ego and that ass. I am there for like a Superman says. It's like you have to enter the home with full of energy.
Okay.
Nothing has happened. They went well. Okay, that stress is out. You go home, and luckily my kids like looking at they cheer every time I go home. They treat me okay. Some superstar or some celebrity has come home. They fight. Okay, I'll open the door. I'll open. Maybe that gives me more energy and pleasure.
That's wonderful. But it must have some bearings on you physically and mentally.
Yes, many of the thing we have to balance. So many of the things happen is like what I am seeing is like from last 2 years I have gained little weight. Not because I am eating excessively or I am eating at very odd time. It's more of a stress where when your stress hormone is more like biologically, your steroids pump up more, the stress hormones. So that's how that stores some fat in your body, so like belly and submandibular chin fat and this all. It's not that you are enjoying eating, boozing and doing even excess stress also can affect your body physically. So you cannot change your profession at this moment of time.
But staying on that, changing about profession, you come from a well-to-do family, I would say, compared to an average Indian family. Have you had a thought sometimes or a doubt, why take so much stress and be in this rather than just quit and enjoy the fruits of the labor from your elders?
To be very honest, till now, not a single time I felt that. Not even a single time. Why? Because from childhood I had, I used to see my grandfather started with scratch. I used to see my father with such a financial crisis, what my grandfather has started, such a financial crisis, he raised again from zero, again he restarted. Then I felt, we have to prove our point and we will do what we are passionate about rather than just taking the legacy.
True.
And maybe the situations created or crafted in such a way that I felt, like at the age, I'll tell you, till 9th and 10th standard, I was not sure what has to be done. I was not sure about my life. When we gave our 10th exam, we joined science in intermediate college. Then we realized, this is what I want to do. And when I started thinking that if I become a doctor, that gave me so much of immense energy. Then after that, I never turned back. More work, throw more work on me, God, I will do it. But I'll be happy.
Why was it that felt? What was the spark?
The same thing I told you. That something has to be done where it should be pure. I should start from zero and generate where I should be not to show people that I should be an inspiration or something that I should inspire myself. You are where you are, how better you are in every 5 years. And if I see back, I feel in 2013 I was just finished my orthopedics and I was just standing the beer bottle in my hand after taking my results. Internet, I'm passed. Let's go to bar. Let's have beer. I think, now we should think after 10 years what we will be doing. We should be a super specialist, or we should be where patients should wait for us and we should give results to patients. So that's how I'm setting myself the targets. Maybe financially I'm little bad or poor in progressing. I don't bother also because that is not my priority. My priority list is this. So it's like every time it inspires me, my work inspires me. I see last year, next year will be much more. Next year. So I keep the data, I keep the record of all my patients seen, treated, happy, unhappy. I take the ratings and everything which me and my team does. And we learn and analyze, we have to be much better this year. So
you seem to be this very driven person who always sets a goal for 10 years and is working tirelessly for 16 hours. All well and good. But what about your family and kids? Do you find time, or is there a conflict there? How do you balance
some
that?
Conflict is there, definitely. It's can't help. It's like a medico's life. That's how kids, that's how kids see their parents. They are giving their best shot. My daughter is 5 years, the son is 3 years. If they see, sometimes I come at night 11:30, they'll be waiting for me. They see my face, dad has come home. They eat and sleep. Again, before they get up at 7 o'clock, I'll be not in the home. Where he's at 5, 6, again I have to get up and go for surgery or something. It's just an, they complain. But what I do is like we have to balance, because this is going to not run for, because they are also human beings. This is going to not run for. So at least what we do is at least some Sundays or at least every Sunday a session. What they need is some 6-7 hours of attention 3 times a week. And whenever you see them or they see you, give a tender, caring talk, listen to them, mainly just listen to them. That will be more than enough. What I learned is the first step of caring is just listen to them. What they talk, whatever nonsense, just let them talk, complain, demand, I want that. Just listen, and just conversate with them. So what I do is Sundays, or especially when I start like it, okay, today sometimes I want like some surgery that's cancer. I get up before them. I may woke them up. I make them brush. I give bath to them. That's how we bond with them. I give bath. I dress up them. I just talking to at their level. Oh, we'll do that. We'll do this. I'll take their cycles. I run behind them. They do cycling. Most of the time in our society, that is the reason I took a gated community where even in the night time also you can nicely roam around. When I go 9:30 or 10 o'clock, you just have a light dinner and we go for a walk in the night. Our society is of almost 1 kilometer. So in that we'll be they'll be taking their cycles out. I'll be running behind them. We'll be talking, chit-chatting, go to have a sugarcane juice or just have ice cream or something, just spend time. Talk to them. That, okay. Still at the end of the day, not like other people who do 9 to 5 job. But okay, we need to balance. That there is no other option for it. Yeah.
So Mithun, you were talking about your kids, and it's wonderful to know that you have some space where you can be really free and that helps you relieve your stress.
Because they don't judge you, that's the best part. So they
not yet.
So till now, so it's good.
Okay. So what I've seen is most of the doctors tend to have their kids also as doctors eventually. Why is that, and do you plan to do the same?
So no, not like that. See, there are 2-3 different aspects of it. Most of the doctors, some are owners of the hospital, who some have the legacy. Like I have many of my friends who are 3rd and 4th generation hospital owners, but their grandfathers or great grandfathers have built a hospital. Okay, so who will run the business? My son will become doctor. His son will become doctor, or his daughter. One aspect is that already they have in hospitals, they are hospital owners. And so make your kid, if he deserves, put him on a payment mode or go to a private medical school, learn and see the business. It's not like you have to run the show or you have to treat patient. Become a hospital owner, you sit and make 10 doctors work under you. One example. Second, getting inspired. Most of the time, maybe I don't know about my kids, but my seniors, their dedication, their hard work, towards the profession, it inspires their kids. It's about from inspiration. Okay, I want to become a doctor because I'm seeing my parents working in the respect they're getting in the society. Third is like self-inspiration. Okay, it's like, what do you want to become? I want to become a doctor. So that's the thing. So there are multiple things, but commonly I cannot say in percentage. Commonly is that seeing your parents, okay, they're working and they're doing good for things, but the respect they get in the society as a doctor. Till now, in India at least, there is a lot of good respect to doctors. Okay, it's commercial, everything okay, but in general, still we are being specially recognized and respect. So that's a good thing. So that thing they get inspired and they become doctors.
So do you ever think about your legacy for your kids or for the society? How you will be remembered?
We should work for that day and for that vision, how you can become better in your view, means how I can judge myself. Okay, you are your best judge. Legacy and this all, you keep doing good work, you keep doing noble work. Don't make it commercial, because it's a very noble profession. It's pure profession. Medical field is, and you can make money. Even you don't need to be complete corrupt. At least some 20% corrupt also you can make more money, which I can do. But we touch wood, we avoid that. We say no. best most of things said to no to corporate hospitals or some doctors. Some will push you, some will tell you, sir, just do it. Just see this patient operator. Just with vested interests. Okay, he has referred and whatever. But to say no and to get that, this is only you do this because the purity you keep, automatically legacy or the goodwill or it will come. It will follow you. You don't need to just, okay, that follow. You just do your work selflessly. Obviously, you have to earn to make for you and for your kids. But even doing things nobly also you can do it. That automatically creates a legacy for yourself, the kids will see, or the surrounding people, your relatives, your followers will see and follow you.
Okay.
That's how, like how Mahatma Gandhi did. He just kept doing his work. So then slowly people followed him and he built a nation. It's like that.
That's a great inspiration.
Yeah.
I just want to switch for a brief moment to one of the previous topics that we were talking about. You see so much death every day or every year, let's say. Does it make you think about your own mortality?
Yeah, that's the thing. We are working and we are getting feared. What happens is, we are, especially post-COVID, it has affected physically and mentally almost each and everyone's life. There are so many examples like 31 years, 35 years, 35, 40 years, doctors dying at workplaces, sudden cardiac deaths, sudden brain strokes and this all. No previous histories of any medical illness and this all. Sudden, but it's not like, no previous, they are never sudden deaths. The stress is causing their heart, their bloods, everything, they become impure. So one thing is, every year self-assessment is important, medical assessment. Like because there is nothing called sudden, there is always underlying thing which comes, we don't bother to check. Array, we are young and this all. We keep working. Second is prevention. Whatever you think, after 30, what I realize, eat less, eat more healthy, and spend 1 hour for yourself.
Okay.
Remember the basic thing which I believe, world will run without you.
True.
World can run much better without you. So never think yourself as a Superman. I tell to my kids and everyone else, even my patients also. Without you, system will run, world will run, humanity will run. It's not every responsibility on yourself. So if you are better, then only things will become better. If you are healthy, you will see world healthy. When you are ill, when you have a cardiac arrest, or when you have uncontrolled diabetes, or when you have an irreversible damage, physical damage to your body, or any morbidity or mortality, you won't see world as a beautiful place. You will curse yourself. You will curse your profession. Because of this profession, you have not maintained it. Because every profession has its own demand. Like us, IT guy, an IT professional who has job of sitting 10 to 12 hours a day. You cannot curse that profession. You make your body fit according to the profession.
Sure.
Because sitting is new smoking. Because that will affect your back, that affects your lungs, that affects your kidney. You work out, you walk, you take cycles, you compensate it. That God has not told or anyone has not told not to do it. It's your willpower. It's understanding yourself. Then only you will be fit, you will be healthy, you will love your profession, you will have no complaints. But if you are just only work, maybe any medical field, one day some mortality comes to you or some irreversible damage comes to you, and then everything what you did goes into vain. The dependent people, the family will be in a tragic problem, and you will start cursing this thing. So better always prevent and prevent it before it happens.
Thanks for your time. It was really inspiring.
My pleasure.
Just one last question. What lessons have you learned that you can share with the younger generation or people who are just coming into this field, or in general people who watch you from outside and think his life must be really great?
What younger generation, whenever they choose a profession, just don't see and choose what is shown to you. See, after 30, 35 and after 40, almost every profession has the upper limit, the middle limit and the lower cadre. It's like you see in cricket also, you see Sachin Tendulkar playing players playing for India and IPLs. You see players playing for state levels and this one, and you see players playing at the local level. Everyone is earning and everyone is making their livelihood. It's like where you want to settle. Means just seeing that on everyone going to that profession is not. You understand that profession. Coming to medical, in medical field, they get doctor to full paisa means full of money. Sorry, I mean Hindi. Doctor means full of money, full of luxury cars, bungalows, and this all. You just put a hospital. It's never that easy. If you are passionate for treating patients or giving a tender care with lot of patience, then only it's always to choose this profession. It's never easy. It's like you are every time you need to an entrance, you have to be best every time you have to give exams, pass, read maximum. Still medicine is such a vast field. There's so much of we are understanding our body, and still we are learning. That's why we are practicing medicine. We are not mastering medicine.
Wow.
We are practicing medicine. We are still learning new things every day. Every body, everything behaves in different way. So it's never an easy money making business. If you are passionate, if you have patience, and if you are dedicated, then only you should choose this profession. Otherwise, it will lead to nothing but mere frustration. And then what happens after frustration? Then we start finding an alternate way. We going in a wrong way. We go in a commercial way and spoil this profession. And ultimately, we play with the lives of the patients.
That was really wonderful of you to give us time. And on that very high note, we'd like to end. Thanks,
Thank you.
Mithun.
Thank you so much.
For coming.